Hello, everyone, and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm so glad you all are joining us today. Stress is something we all experience, but how often do we stop to think about how it's affecting our physical health? From headaches and fatigue to high blood pressure and chronic conditions, stress can show up in ways that we don't always recognize. Today, we're joined by Autumn Castro, CRNP, with a background in preventative care, chronic disease management, women's health, and patient education. Autumn takes a whole person approach, considering each patient's physical, emotional, and social needs. Today, she'll help us understand when everyday stress becomes a health concern, and she'll share practical steps to help us make it better and to manage it. So, whether you're a patient, caregiver, clinician, or simply someone interested in learning more about your health, we're glad you're here. So, stick around to learn more, share this broadcast with your friends, and if you have any questions, you can ask those in the comments below, and we will answer as many as we can during today's discussion. So, Autumn, thank you again for joining us. We really appreciate it. If you could, before we get into our questions, could you tell the audience a little bit about yourself and the work you do here for MedStar Health?
Of course. Thanks for that, Sarah. So I'm Autumn Castro. Like she said, I am a nurse practitioner. I practice in family medicine in Charlotte Hall. It's a cute little clinic. If you haven't seen it, come on by. I'd love to see you. Outside of MedStar, what I do helping take care of patients here. I'm a mom. I have a bunch of kids. I'm married and stay very busy. So stress is very real to me. So I'm excited to talk to you about all of this.
Thank you. Yes, I am very excited to hear about this as well. So let's get into our questions. We'll start with the basics. How does stress affect the body, both short term and long term?
Great question. So short term, it within minutes of having a stress trigger come to us, our sympathetic nervous system takes over. It releases epinephrine and norepinephrine. At the same time, our HPA system, which is the hypothalamic pituitary adrenal axis, releases cortisol. The two of them together, they make the fight or flight response, which I'm sure you've heard of. So, some of the things that we can see instantly are an increased heart rate, increased blood pressure, our glucose goes higher, blood viscosity, which is the thickness of the blood, gets higher, inflammation markers raise, and our mood can be inflamed. So, this is a great response if we need to run away from a lion. We need all those resources. And those can last for about 30 minutes short term. Great. That's a great idea when it's short term, when it's fast, and when we need it. Long term, though, that's not so great. So, prolonged exposure to the stress hormones can actually damage multiple organ systems and can lead to heart disease. So, some things like clotting problems, as I just said, the blood gets thicker. So, that can set us up for blood clots. Can raise the cholesterol inside the body, can cause the arteries to stiffen over time. All of these things together can make hypertension or high blood pressure more complicated to treat. Can also eventually lead to heart failure and stroke. Can cause metabolic disorders like insulin resistance or diabetes. You heard me say that the glucose raises, and over time that just continues. Can cause our immune system to be disrupted. So chronic inflammation can make our immune system a little slower to respond, which can actually lead us more into getting ill more, or having a harder time kicking something that maybe a common cold that someone should kick quickly may have a harder time going through because our immune system is impacted. Also, mental health conditions can cause anxiety or worsen anxiety, PTSD, depression, and also interrupts the gut microbiome.
Interesting. And stress is often thought of as like emotional or mental. How do the physical symptoms show up, or some of, the physical, I guess, maybe triggers that would lead somebody to recognize, hey, I'm stressed, my body is having this physical reaction?
Yeah, so I talked about some of those things in our last question. Again, high blood pressure, increased heart rate, gut problems from either way, constipation or diarrhea, indigestion, heartburn. But if you want specific numbers, I looked them up for you.
Perfect.
So patients who have chronic stress can present in this way in primary care. So 75% will come in with fatigue. or low energy. 56% insomnia, sleep problems, 40 to 65% headaches, 67% GI concerns, 49% low back pain, and 43% heart palpitations.
I know for me, the insomnia is a big one. That's one of the biggest ways I'm able to tell I'm super stressed is I just can't sleep and I'm just going, going, and going. What is a common myth about stress that you would like to debunk? I'm sure there's plenty of them.
I think a common myth that I'd like to debunk is it will go away. I think sometimes our society has a way of saying, you're fine. It's going to be fine. We've been doing this forever. But maybe you're not fine. Maybe you shouldn't be just swallowing this and pushing it down. Maybe we should talk about it. So I really just want it to not be silent anymore. I want everyone to talk about it. It's not something that goes away for every single person. And some people need multidisciplinary approaches to help handle the stress. And there's nothing wrong with that.
Yeah, I think kind of going along with that too, the more that you put it off, the more maybe numb you become to it. So then like you just continue, like you said, piling on more stress and it almost becomes normal in a sense. Like that's your normal behavior is being stressed. I know that I've experienced that in the past. Is that something you'd say is common with other patients too?
Absolutely. If you looked at our productivity levels as a society today versus 50 years ago, you would be floored. We are working ourselves to death. We are taking on more and more activities. We have one to however many children you have that have each of their individual activities. Our schedules are insane compared to where they were previously. And now we're also holding ourselves to these higher and higher expectations thanks to social media a bit. We have all these unrealistic expectations that Sarah's on Facebook and she looks great and she has no problems. What's wrong with me?
Yeah.
So I think that's a piece of it we need to think about too. Is our standards are very high.
Yeah, I totally agree with that. Next question, a little bit of a fun one. Finish this sentence. Managing stress is important because blank.
Because your health matters. You matter.
Love that. Going on to stress and chronic health conditions. Stress can also play a role in ongoing health conditions, as we've talked about a bit. But to go a little bit more in depth into it, how can stress impact chronic conditions like high blood pressure, diabetes, and heart health, which again, you touched on, but I think is important to talk about again?
Yeah, sure. So if you wanted to dig a little bit deeper, stress activates a hormone inside the brain that communicates with the kidneys. And one of the signals that it sends is, hey, I need you to increase the blood pressure. We've got this stressful thing going on. That chemical it responds to stress. So the more stress we give, the more we release that chemical that tells the kidneys, hey, keep increasing the blood pressure. So now we're up against this chemical that's telling the blood pressure to continuously go up, 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 and it makes it tricky to treat because we're going against the body's system. So that's one way. Diabetes, the same thing, like I told you before, in that fight or flight mode where we're trying to run away from a lion and we get a pour of glucose because we need it for our muscles to work, whatever we need to do. Um, Over time, that glucose keeps getting spilled and the body starts to try and produce more insulin to handle that. But sometimes that balance is not proportional, and we can end up with things like diabetes or insulin resistance over time because we're having higher levels of glucose. And then heart health in general. Stress hormones can impact the heart rate as well as we talked about the arteries being stiffer and can increase high cholesterol, which can put us at a higher risk of heart attack or stroke by even up to 50%.
Oh, wow. And this is also something we kind of addressed earlier, but when should someone start to see stress as a health concern rather than just a normal part of life?
Yeah, all of us deal with stress. Probably every single day you can think of something that has given you stress for that day, and that's normal. And that's where we should be able to handle through those things. But I would say if you had something really traumatic, like a death of a loved one happen to you, clearly that's a very stressful event, and that's not going to go away instantly. So they kind of put a marker on that for about a month. If after a month of the big stressful event you're still struggling, you should come in and see us and talk to us. Additionally, if that stressful event is causing you to have things that are interfering with your daily function, like um, panic attacks or physical symptoms that are so bad that you can't get through them, come see us. That's also not okay. And then some symptoms that are concerning emotional regulation issues. If you feel like you're snapping constantly or you're really tearful all the time, and it's not really proportionate to what's going on, come and see us. If you're having difficulty concentrating, if you're feeling withdrawn, like, I love ice cream, and all of a sudden I don't really care about ice cream anymore, there's a problem. Ask my family. So we should be aware of that. Substance use, of course, is concerning. If you find yourself gravitating towards substances to adapt, that's a problem. Come talk to us. Flashbacks, more for like PTSD patients, flashbacks, or nightmares or heightened arousal. If you're very jumpy and you feel like, oof, everything's making me on edge, come talk to us. Additionally, some physical symptoms I don't want you to ignore: heart palpitations, if you're having problems with your blood pressure, chronic pain, dizziness, and headaches. Come in and see us. Let's make sure it's not a physical issue first, and then let's talk about the stress underneath.
Yeah, that's a good point. Yeah, to make sure you get those things checked out because it could be, like you said, a physical something. And if it's stress, that's a good way to figure that out and then learn how to manage it. And it can never hurt to just check in and see what your doctor says. This next question is an interesting one and one I never really thought about. Are there differences in how stress affects men and women or any unique considerations when it comes to women's health?
Yes, ladies, listen up. I am so sorry.
Oh
Stress
no.
impacts us in a much bigger way than men. Men are built to handle stress a little better than us. So I was reading some studies, some ways that women are impacted more by stress compared to men, is our inflammation markers are higher. Our platelet aggregation, which means the stickiness of the platelets, is actually about 2 times higher than men, which puts us at a higher risk of heart disease or things like strokes, blood clots. Higher rates of depression, twofold, again, for women, and higher cortisol blunting. Cortisol blunting is cortisol is a natural stress hormone that's released in our body. Women can have a really hard time regulating it. So the body is kind of chasing its own tail more consistently with women. That if you watched our cortisol over time compared to men, you would see that it's not well controlled when we're under stress. So when women come to me in clinic and I'm seeing these diseases that I know can be impacted by stress, I kind of have to work backwards. We talk about the physical symptom first, and then we kind of go backwards to say, hey, where could we do better to see if stress is actually making this worse, which it likely is. How can we handle that stress?
Right. And talking about recognizing the signs, sometimes they can be easy to miss, as we've discussed, or just easy to push to the side and move on. Um, what are some common but overlooked signs that stress may be affecting someone's overall health?
Yeah, so I feel like we talked about that a bit earlier. So if you're having heart palpitations, if you have high blood pressure, first of all, please check your blood pressure. If you're seeing that your blood pressure log numbers are not normal, or they're bouncing all over the place, or they keep getting higher and higher, don't ignore those. If you're having headaches daily, please don't ignore that. If your gut is a mess and it just won't calm down no matter what you eat, don't ignore that. Come in and talk to me. And then again, like withdrawing behaviors, substance use, difficulty sleeping. I think none of those things should be taken lightly. And if you see multiple of those, that might be your trigger warning to say, hey, I think that I might have some stress problems here.
Yeah, good to know. And how do you approach conversations with patients about stress, especially if they come in for something physical and maybe aren't expecting the answer to be you're very stressed out?
Yeah, I think we live in a society, like I spoke about earlier, where we don't necessarily like to think about stress being the problem. We want it to be a physical problem because I think many of us think, oh, I have high blood pressure. If they give me this pill, then I'll be fine. It's just my blood pressure. But, and that's easy enough to take a pill. But if you said, hey, Autumn, your blood pressure is high because you're not sleeping well, because you're not handling your stress well, and maybe we need to talk about therapy, those things, one, I don't think they're as socially accepted. And then number two, I think that we think of them as, oof, those are really hard things because they're behavior modifications, because that might mean I need to talk to somebody. That might mean I need to face this monster thing in my life that I don't really want to talk about. So what do? I listen. And I say, okay, we're going to work this up from a physical standpoint. And then when I've shown you these numbers maybe are not necessarily just because of this physical process you going on, but also you have some stressful things going on. I think that takes time. I think that takes a rapport, and I think that takes listening. So I ask questions like, Sarah, how are you really doing?
Yeah.
Tell me about your family. How's things at home? So that you can know it's safe to talk about things that may be a little bit harder to talk about, like stressful things.
Yeah. Yeah, I love that approach. I recently got blood work done and my cortisol was through the roof. And so I was expecting the answer to, like you said, kind of be, oh, well, here, take this, that'll help lower it or whatever. And I was told, take a step back, like relax a little bit, go for walks, like stuff talking about your gut, like diet changes. And that was a harder, pun intended, pill for me to swallow.
Yeah.
Because like you said, it was taking changes within my daily life when sometimes I feel like you don't, because you're stressed, you're like, I don't have time to make these changes. Like I'm working, I don't have time to go for walks to clear my head, like that sort of things. But I will say doing those things did help and my cortisol levels lowered. So it's important to do.
Yeah.
Um, but so I'm going to pause for a second and reintroduce us. If you're just now joining us, thank you for tuning in. My name is Sarah, and I'm here today with Autumn Castro, CRNP, and we are discussing how stress can affect our physical health. If you have questions, you can leave them in the comments, and we will answer as many as we can throughout today's discussion. And we have a lot more to talk about, so keep watching. Let's talk about now what people can do to reduce stress in their daily life. I might have just given some of those away talking about what I've done, but you're the expert here. So, what are some simple, realistic strategies people can use to better manage stress day to day?
Sarah, I loved how you said, I don't have time. I hear that every single day. I don't
Yeah.
have time. First of all, let me challenge you because if you have time to be on social media, hello, we're on Facebook,
Yep.
you have time to do something to help manage your stress. So I just wrote down some of my top tools that I love that are supported by research. Number one, exercise. It's not about going to the gym and torturing yourself and hating your life. It's about finding something that you love. If you want to go for a walk in nature, go do it. If you love to ride your bike, go do it. If you want to do a Pilates class, go do it. Not only that, but find your people. I belong to a gym and I love them because if I don't show up, I'm going to have text messages to say, where are you? What are you doing? What's going on? Find your people, find some account. Even if you're just one person who's accountability partner who can be like, hey, I missed you at the gym today. That goes a long way. One, you're releasing chemicals that make you feel good. Two, you're literally helping your body with every disease process that we have. And three, it's an awesome stress reliever. When you get to that point, whether it's doing yoga where you need to slow down your system, or for me, I can't slow down my system. I have to just beat my body hard for it to calm down and for me to feel like things are peaceful now. So lifting something very heavy at the gym calms my brain down. When I'm done with everything, I'm so tired and I'm like, oh, that feels so much better. So give it a shot. Just give me 10 minutes, 10 minutes somewhere. Number two, um, prayer, mindfulness, breathing technique, or relaxation, wherever that lands for you, whether it's, oh my gosh, I just got terrible news. Let me just stop and pray for a second. Or let me just put on a mindfulness video that I can just look around me like, okay, the wind's blowing the tree leaves. That's something I can see and hear. Oh, what is that smell that I smell in the air? I can smell the flowers blooming. Just being aware of who you are in that moment and letting go of everything else. There's a million like breathing relaxation techniques. That's something that you can do in the moment when that big bad stress hits. But not only during that moment, but make it a habit of your day. Spend 5 minutes doing something to calm your spirit, whatever that looks like. There's 1,000 apps out there. The Calm app, shout out, love them. They're great. But there's 1,000 apps out there and YouTube videos, anything that you could possibly think of. One of the things, Sarah, you said you struggle with sleep sometimes. One of the things that I absolutely love is I have an app that I keep on my podcast library that is guided meditation at night. If I have a hard time sleeping, I bring it up and I listen to it, and it helps me to fall back asleep. And I don't know what I would do without it. So look into something, find what works for you, and what works for you may not work for me. And that's okay to find what works for you. And then the third thing, social connection and support. We are not meant to do life alone. So whether you have one person that is your ride and die, or whether you have 10 people that you meet once a week for coffee, whatever that looks like, to be able to talk to people. And I can't speak enough when I say therapy is amazing, counseling, therapy, whatever you want to call it. Having an open space, somebody outside your normal life to just talk about all the things that's bothering you. All of us could use therapy. It's not taboo. Let's do it.
Yeah, I love that. I totally agree with all that. I know you kind of mentioned this, like adding it into your daily routine. One thing for me that I did was starting my day off with like a 15-minute walk. And that was easy for me to do because it was adding something into a schedule rather than just saying like, oh, I'll do that eventually. It was like, no, I'm going to wake up and do that. And it just became a part of my daily routine. And also talking about getting into things you love, I started playing soccer again because it was something I love doing and it's physical exercise. And those two things alone helped so much with relieving stress. And it can be hard to think about adding something else into your routine. But like you said, we're on social media or we're doing, we have time in our day to add a little something to help relieve our stress. Um, and how important is preventative care in identifying and managing stress before it leads to these bigger health issues?
Right. So stress is accumulative, just like everything in life. One French fry is not going to kill you, but if you eat 100 French fries every single day, those are going to start adding up and clogging your arteries. Think of stress the same way, or like a cancer diagnosis. It's always best to find it when it's early, and we can try and modify it. And we can try and fix it and have the best possible outcome we can have. The longer we wait, the harder our arteries are getting, the higher our cholesterol is getting, the higher our blood pressure is getting. And when you come to me with those disease processes that are small and easy, we can get you to a much better place. When you come to me years later and you have all these multiple diseases and they're all in bad shape, it takes a longer time for me to get you back to where I'd like you to be. And some of these disease processes are not reversible. They're just manageable. So the sooner we can catch them, the better off we're going to be.
Yeah. And many people feel overwhelmed when they realize stress may be affecting their health, as we've said. So for those patients who do feel overwhelmed, where should they start when it comes to improving their mental and physical well-being?
Primary care, hey. Seriously, primary care, it's our job to build a rapport with you. And so we should be a go-to person. Talk to me, talk to if you feel like you can't talk to your primary care provider, do you have a therapist? Do you have a behavioral health? Your insurance typically pays for behavioral health independently. So if you feel like you need therapy, Psychology Today is just a regular old resource. It's not sponsored by any company or anything like that, but it's a great resource where you can find some providers if you need that extra help. So primary, I think, is a great place to start, but you could also start with behavioral health or anybody who's willing to listen, really.
Yeah. And what role does patient education play in helping people understand and manage their stress?
Yeah, so I think that the internet is out there and it's full of education, and that can be a very beautiful thing, but also can be a dangerous thing. So one, trust your sources, but I would rather you get educated and understand the disease process. So when you come to me and you're saying, hey, Autumn, I already know that I have high blood pressure and I know that it's affected by these things and this is what I'm thinking. If I can help you understand your disease, great. If you understand your disease already, awesome. And we can do a better job treating it. The more that we understand something, the better off we're going to be to treat it.
And what's one small habit that can make a big difference in managing stress? You've given us a lot of good tips, but what would you say can be the maybe the easiest thing to start off implementing?
I think a walk is a great place to start if you're able to walk. Start with even 5 minute, a 5 minute walk every single day. Great for your body, great for your mental health. And you can find 5 minutes, I promise you. And if you can't walk physically, there's some awesome chair yoga videos out there. Don't knock it till you try it. That if you are stuck in a chair, you're not able to walk, you can do something. There's something out there that you can do. You just have to think outside this little square box that we put ourselves in sometimes.
Yes, yes, I totally agree with that. And I am a big fan of walks, so I second that. And when is it time to seek professional help for stress? What's the one, couple of key things that would signal somebody that, hey, I should talk to a professional about this?
So I think that if you're finding that your emotional or physical symptoms that we talked about earlier are impacting your day-to-day function. If you're not able to get through a meeting without having heart palpitations or stomach pain or headaches, we need to have a conversation. If you feel like if you're not sleeping, we need to have a conversation. Sleep is so vital for our body to reset and repair everything. If you're not sleeping, come in. But mostly if you feel like you're not able to get through the day without finding yourself going, ugh, come in, talk to me.
Yeah. And how can primary care providers support patients in managing stress and chronic conditions together? You've noted it a couple of times, but just to go over it again.
Yeah. So I think my favorite thing about primary care, like I said, is that I get to build a rapport. I get to learn my patients.
Mhm.
I know if you have three huskies at home. I know if you have a brand new grandbaby. I know if you're riding a Harley at 80 years old. Just these little things that I get to learn about my patients when they come in. It's beautiful to me, and I love that part of my job. Um, and so I want you to be able to come to me to talk to me to say, hey, I've got a problem, and this is stress. If we build that rapport where I feel more like a friend, not a friend, but more like a friend that you could talk to, a professional role, of course, but somebody that knows you and you could know when something's not right. Even if you can't get the words out, but if you could just come in and say, hey, I'm sad or I'm angry or I'm stressed, having somebody who has a good rapport with you or someone who can look at you and say, oh, Sarah, you don't look right today. What's going on? That's a beauty of knowing our patients.
Yeah, I love that. Yeah, that's super important and beneficial to have that sort of relationship with your doctor and with, doctor with their patients. We do have a question from one of our viewers. What's one word you'd use to describe the impact of stress on the body?
Havoc.
That's a good one.
Yeah.
And we have another question. Do you recommend any screenings or tests to rule out stress-related conditions?
Yeah. So if you come into clinic, our MAs, please listen to them and please be honest with your answers.
Yes.
They are a piece of us and we love them and we need them, but they screen for anxiety and depression. We use the GAD-2, GAD-7, and PHQ-2 and PHQ-9 scores to gauge where your anxiety and depression are falling. These numbers translate to a score to us, and that score helps us to understand what we should do moving forward if we need to treat your anxiety or depression if you're scoring with those. The other thing is we screen for substance use, smoking, drugs, and alcohol. Be honest about that. If you're struggling with that, we can help you, but we have to know about it first. So that's a screening that we do. Those are the main things that we're doing here.
Okay. Another question from one of our viewers, Sherry. They ask, are there any medications for stress or anxiety, and when are those appropriate?
There are a slew of medications for stress and anxiety. And when are those appropriate? We would use the screening tools that I was just speaking about, and those numbers would help translate. And also, if you tell me how much is it impacting your life, there are as needed medications that I love for anxiety. Something like hydroxyzine is a great drug for that. If it's a daily impacting your function and how you're doing. I love Zoloft. It's an SSRI, can help for anxiety and depression. It's a great med. But really, it would be shared decision making. You would tell me, one, I think that if you feel like we need to talk about medication, then we are also going to talk about therapy, because for me, it's a two-pronged approach. Medication and therapy should go hand in hand together, because you clearly need to talk about the things that are bothering you so that you can process them. Sometimes just saying them out loud gives them less power over you and you can feel better. But yes, there are plenty of medications out there. And if what we're doing is not working, there are multiple other ones. And if we still can't find the great balance, there's an entire field of medicine devoted to mental health, psychiatry, and psychology. And those guys will figure it out, and they will get the correct diagnosis, and they will find the med that balances you. The thing is, sometimes it's a patience game, and you just have to hang tight while we figure it out and get you where you need to be.
Yeah, I've been through that before, and it can be a tough thing to go through. You're like you said, it's patience, and we are impatient people, and but it is worth it in the end once you stick with it and find what works best. We have another question from Thomas. How can I build a long-term plan to manage stress and prevent burnout?
So I think building a long-term plan, really what we need to start with is the first steps. Where can we start with? What can we do today? And once you build a habit, just like you did, Sarah, you said, that's it. I'm going to wake up. I'm going to start this 15-minute walk every day, and that's it. Once you get yourself into that habit, you're going to start feeling, oh, wow, my brain feels a whole lot less cluttered. I feel like I can start my day off on the right foot. Or for me, I go to the gym after work, and all of my stress from the day of everyone that I've heard and everyone I'm trying to help and every frustrated thing that I've come across, I'm lifting something heavy in the gym and it goes away. So I can come home, and when I'm coming home, I'm mom and I'm wife, and all that stuff from school, from work, has been left behind at the gym. And that's how I balance it. How do you do that long term? You make those decisions day by day by day by day. And if you feel like you're getting burnt out, I would recommend that you look at your schedule, look at everything that you're doing. Where can you scale back? As I said before, society puts so much pressure on us and so much stress that we're supposed to be doing this and we're supposed to be doing that. If you feel like you're burning out, look at what's on your plate and what can you take off? What can you rebalance? Do you have a spouse or a partner or a family member that could help you take a few of these responsibilities and get some of this stuff off of your plate? Long-term plan, start day by day, and it will start to build up.
Yeah, I love that. Another question from Alex. Can caffeine be making my stress worse? I think that's a good question.
Absolutely. Caffeine is a stimulant, but many of us have a problem with caffeine because it helps us feel more productive. But certainly, if you're drinking too much caffeine, 1,000%, it can irritate every single system in the body. And if you're struggling with anxiety, that's one of the first things I will ask you is how much caffeine that you are drinking. Whatever your number looks like now, try and decrease it a bit and see how is your anxiety responding. If you're drinking caffeine, I would say past whatever 2 o'clock, 3 o'clock, 4 o'clock, wherever your o'clock is, everyone's a little bit different, and you're noticing that you're having a hard time sleeping, bring that back, start there. And I would start afternoons, try and bring that down a bit. Toy with your body, it's yours. So you can see, okay, I know I'm good at 2 cups of coffee. If I drink 3 cups of coffee, maybe not so good. So you just got to see what works for you. Do a science experiment. Figure it out. You will.
Yeah. Yeah, I know. I used to love my daily Alanis, and I had to cut those down because it was too much. And it really did help when I started cutting those out. I would drink a half, and like now it's one half every other day, like that sort of thing. And it was tough to, like you said, figure it out and figure out what did work for me and what didn't. But yeah, cutting those out really helped a lot. The caffeine was a big issue for me.
Mhm.
Um, Madison asked, how does stress affect hormones and things like weight or metabolism?
Yeah. So one of the things we talked about earlier was that a quick stress response to the body increases glucose, but long time stress responses can keep those sustained glucose levels. And also, stress a stress hormone that's released when we're under stress is cortisol. And so as we're having more and more cortisol in our body, it leads to weight gain, specifically around the midsection. So that's one way, is that increased risk of cortisol or increased levels of cortisol can lead to weight gain around the middle. Increased levels of glucose can lead to insulin resistance, which can also lead to weight gain.
Thank you for that. And thank you to our viewers for their questions. Those were some great questions. My last one for you, Autumn, is as we wrap up, what's one key takeaway you want patients to remember about the connection between stress and their overall health?
So I think simply we can think of stress as a silent killer, but we don't have to be silent about it. Let's bring it to the surface. Let's talk about it. So when you come to me and you're worried that you can't get your blood pressure under control, keep your mind open when I ask you things like, what are you doing to manage your stress? Don't be afraid to talk about it.
That's great. I think that's the perfect note to end on. So that brings us to the end of today's discussion. Thank you again, Autumn, for joining us and taking the time to share your expertise. And thank you to everyone who joined and asked your questions. Understanding how stress affects our health and learning practical ways to manage it can make a meaningful difference in our overall well-being. If you'd like to learn more about stress management or connect with a primary care provider, please visit the link in the comments below. Thank you again for joining us, and we will see you next time.